the fire, dark in need of light. Every time you inspire, the change in me tonight. Take me higher, so not far from you. Night and desire, burning love tonight. I adore and this right. You love to fly, ignite our bones. Oh, when they strike, we light up the world tonight. I adore, they strike, feel the love, sparks of fly, ignite our bones. Oh, when they strike, we light up the world, we light up the world. From there, you're from wide, perfect strangers in the night. Here we are, come together, to the world we'll testify. Our hearts alive, firestorm, when they strike, feel the love, so fly. We ignite our bones. Oh, when they strike, we light up the world. Firestorm, oh, when they strike, feel the love, sparks so fly. Ignite our bones. And when they strike, we light up the world.
Good afternoon. By way of introduction, those of you who don't know me, I'm Dr. Samir Hinduja, and I'm in the School of Criminology and Criminal Justice. And it is my honor to serve as MC for today's third annual Research Symposium for the College of Social Work and Criminal Justice. When I look around this room, I'm impressed because I know many of you, I don't know all of you. And it's really remarkable to think that we've got individuals who are devoting their professional life to tackling some of the thorniest and most consequential issues of our time. Think about aging, think about addiction, think about criminal justice reform, child welfare, housing, mental health, well-being, and of course, technology. We're making a grand difference as we continue to do research that affects policy, practice, and many individuals' lives. I also want to give a nod to the staff. The staff are the wind underneath our wings, and you all make a difference in so many ways, countless ways. And I'm not sure, sometimes it feels like you have thankless days, but please know we are deeply appreciative. I'd like to specifically give a shout out to Catherine Fraser-Jones, who has been by my side as we work together to make this a reality. Also, Tony and De Niro, thank you so much for all of your help. I'd also like to convey my appreciation to Matt Canavan for all of his help as it relates to AV and IT. And then also Edelyn and Tara were very helpful in breaking this all. Before I turn it over to our dean, I want to emphasize something that's been said, but bears repeating. We're driving around campus and we're seeing these light posts, and many of them have a specific banner. That banner indicates that for the first time in the history of Florida Atlantic University, we are in the top 100 public universities according to the U.S. News and World Report. I think that is absolutely incredible, and I would say that we're in great part assisting in that, helping to elevate what our university is doing. So our college is going to continue to do that good work, and the dean will also reference that as we move forward. But for now, please allow me to turn it over to our founding dean, who's built our college into what it is today. Dean Luna, the floor is yours.
Thank you so much. And I'm going to put the credit back on that side of the room. You have built the college for what it is today. Hello and welcome. Good afternoon. My name is Naelis Luna. And as the dean of the college, it is my pleasure to welcome you to our third annual research symposium in our college. And this year's theme is how AI and technology are transforming discovery. And this theme invites us to reimagine what innovation truly means and who leads it, who leads innovation. So when you think about artificial intelligence and technology, people often think about STEM disciplines. But here's the powerful truth. You ready for powerful truth? Here it is. Technology reaches its highest potential only when it is guided by human insight, ethical purpose, and a deep understanding of a society. This is where this college leads. This is who we are as a college. The work happening here in our college is not adjacent to innovation. It is central to it. Our faculty and students are shaping how technology is responsibly developed, thoughtfully applied, and meaningfully integrated into real lives and real communities. This is what we do here in our college. Our work is uniquely positioned to identify emerging societal changes that technology can change the game, to help design, implement, and sustain innovative solutions that serve the public good, to examine the ethical and human impacts of their implementation, and to ensure that these advancements are accessible so they can offer a hand up to everyone, not just a few. So our faculty are exploring how technology shapes public safety, justice, mental or behavioral health, healthcare, child welfare, and communities in general. Samir mentioned this as well. So they are researching best practices for engaging technology thoughtfully and responsibly, and for translating discovery into real-world impact beyond the lab, beyond the coding screen, beyond the latest chatbots, and into our schools, into our hospitals, into our homes, into our communities. This is where lasting change takes hold in our college. The College of Social Work and Criminal Justice is proud to be an integral component of the Florida Atlantic University R1 research enterprise. We are doing our work. We are contributing to our success. The critical work happening here in our college advances the university's collective scholarship by keeping humanity and ethics at the center of innovation. So today, here's my call for you. Listen with curiosity, ask bold questions, because we are a bold college after a while. Ask those bold questions and connect during and after with our presenters. Please also stay for the reception and our students' research showcase that is going to happen afterwards. So we have so much to look forward to today during our research symposium, and we thank you for being part of it. I also want to thank Dr. Samir Hinduja for his leadership, putting all of this together, and an incredible team that he mentioned behind it. So now I'll pass the mic to Dr. Samir Hinduja, who is a professor in our School for Criminology and Criminal Justice and co-director of the Cyberbullying Research Center as well. Take it on, Samir. Thank you so much.
Thank you. The keynote presentation sits at the intersection of a number of topics that I find genuinely interesting: child welfare, technology, and the ethics of AI, how we're using it in order to serve vulnerable families. Dr. Morgan Cooley serves as Associate Professor in the Sandler School of Social Work, as well as Interim Associate Dean for Research. With that, I'm going to turn it over to her. All yours.
Wonderful. Thank you so much, yeah. Just in case I need to watch it. Thank you guys so much for coming today. When I heard that I was going to have a whole hour to present, I got really excited. And then I was told that I had 15 minutes. So I'm going to keep things moving, but I am going to talk a little bit about how we support children and families within the age of technology and AI. My goal here is to give you enough information that you can impress your friends at dinner parties while also having them not ask you too many questions you can't answer. But in reality, what I'm going to do is just give you a very broad overview of one, kind of what are some of those primary needs of children and families in the child welfare system.
Thank
you. Two, do I need a microphone?
No, I'm just going to move these Zoom.
Oh, thank you. Two, some of the examples of how we're using technology and AI within the child welfare system.
Thank you.
I'm going to talk a little bit about some of the implications of AI use that are very specific to child welfare, but also very broad to other systems. In many ways, the child welfare system lags behind, and in many ways, there are many more experts of AI sitting in this room than the ones that we talk about in our research. But that's important to talk about because I'm not a technology person. I'm not a data scientist. I am a clinician with a research degree in family science and social work, right? And then I'm going to give some examples about ways that we're partnering with the state in order to kind of leverage or understand technology and AI use a little bit more.
There's a button on this. There you go.
There we go. So just to give a really brief introduction, and this is not specific to AI, my primary interest is in youth mental health and foster caregiving. But one of the things that theory teaches us, and I'm not going to give you a lecture on Brockenbrenner today or ecological theory, is that every time you're thinking about an individual, you're looking at an individual who is nested within a family, who's nested within a house, who's nested within a neighborhood, who's nested within a community, who's nested within a larger system. And so even though a lot of my research is kind of more specific, if you look at kind of the things that we've done or the past publications of our teams and things, really we don't do anything in isolation. There's always somebody following us around or some system following us around. And when it comes to technology, technology impacts training, it impacts policy, it impacts support, and technology and AI are a very hot topic right now. So we'll just kind of put that out there. But just to say that, there are so many ways that we can kind of think about how we work with families, but also to know that, we might be specialists in one area, but we have to be able to understand how technology fits within the context of our everyday work. All right, so when it comes to the needs of children and families in the child welfare system, one of the primary overarching goals of the child welfare system is to protect children from abuse and neglect, to help them to be safe, to ensure their well-being and permanency. One thing that I always have kind of presented as a critique among our child welfare scholars and those who look at family research is that very little is said about parents and family in that mission. It's very child focused, but one of the best things we can think of is you can't save children without helping a family. And so when I put out kind of the needs of children and families, I do want to kind of highlight that there are so many pieces, and that when you help a child, you help the family, but when you help a parent, when you help a caregiver, when you help a professional, you also kind of help to promote the well-being of children in many different ways. And so we commonly think of poverty, financial difficulties as being the primary reason that families enter the child welfare system, often through the lens of neglect. We have substance use, mental health challenges, but when I think of needs, I like to think of things through capacity and strengths. What do we need to do in order to build the capacity of families in order to weather the challenges that they experience? So from a protective factors lens, the things that kind of they need to leverage in both their individual lives as well as kind of their family or their community lives. Families need concrete supports, a roof over their head, a meal on their table, the clothes on their back. They need the knowledge of parenting and child development to know what's normal, what age and stage is my child going through, and how do I support them at this point? Because some families enter the system because their children have mental and behavioral health challenges that they can't handle. How sad is it that families have to get help through a formal system and that we don't have some of these resources more readily available to help them to know what they needed to know 5 years ago or 10 years ago or those things? Along with that, parents need to be able to support the social and emotional competence of children, help them with emotion regulation. Parents need their own support. They need to be resilient. They need to know how to bounce back from challenges and how to cope and handle stress on their own. They need formal connections through systems when things get really tough, or just a doctor sometimes. But they also need friendships and family. So when we kind of paint this picture and you think about technology and AI, there are so many different ways that AI is already impacting the lives of family. But in some ways, families who are impacted by child welfare don't always get to benefit from some of those innovations and things. So let's just talk a little bit briefly, and I know I'm already like almost halfway through my time, I think. But talk a little bit briefly about where technology and AI show up in child welfare. Within technology, I know everybody's probably really tired of COVID, but COVID still hangs around, and COVID hangs around in good ways though, because you know what? In some ways, we're using telehealth, we're using virtual services in ways that we didn't before. It's allowing access to rural neighborhoods and rural communities. It's also allowing for easier access to visits between children and parents. Before there were video options on a phone, what did people do when you wanted to have a child say goodnight to their parent while they're living in a foster family separated from their primary family? Things are a lot easier and getting a lot easier. We run court, we run services, all using technology. We also have mobile tools for documentation. We have tools for information sharing. When you are thinking about the role of child welfare workers, we are thinking maybe investigating child abuse, setting out services, accompanying parents or children to visits, helping with transportation, testifying in court. Maybe you serve as a legal professional or you serve as a mental health, medical, educational professional. There are so many different ways that we need to share information. We need to connect. We need to be on the go. And a lot of times child welfare workers, it changes. Every once in a while, you'll hear like, well, I just sit at my desk and write notes all day instead of spending time actually engaging with families. That's still like a lot of the truth in some, but it's getting better because of technology and the access that we have. Case management software, much like an electronic health record system, we need ways to kind of code information. Well, you know what? I've seen child welfare record systems. They are not as advanced as EHRs. They don't have reminders that pop up and say, hey, did you do this? And did you do that? And your 1 week period is coming up. There's so many ways that we have not leveraged some of these innovations in the same way with the child welfare system. Virtual reality, and I'm going to give an example of virtual reality as well. For AI, so the big note or the big important thing to think about, states are doing everything very differently. I'm going to show you a brief model. I won't get to explain it too much, but people are in different points of innovation in terms of how they've adopted or thought about AI. We do use AI for identifying risk. Are we able to see who's more at risk for child abuse or neglect? Can we use it to understand whether somebody's going to be more successful in a placement in a foster care home? Those kind of things. So we can identify, are there indicators or data that help us track what could happen with families? Sometimes that software doesn't work the way you want it to though. And within child welfare, it's a specialized population. And we are finding even in Florida has tested some of those and not had the luck that they wanted to have. They found it to be biased and those kind of things. So just to point that out. In terms of supporting documentation, we're at kind of the early stages of, taking unstructured interviews and sitting down with families and being able to fill in forms without much oversight. But There's concerns about child welfare workers maybe not checking their notes, families not getting to view those notes, not having a say, and how do we use that process, especially when we're working with people who are very vulnerable or at one of the most difficult points in their life. We also have different models that are coming out that allow for interviewing options. And the AI part is that they get feedback. Did they apply the motivational interviewing intervention the way they needed to? Did they engage the way? Did they use open-ended questions and those things? And then lastly, one of the really neat things that Florida has done is the Department of Health and Human Services recently partnered with a nonprofit to use AI software to place children with higher medical needs with foster parents who had indicators in their records that would make them a good fit. So it was just a pilot. So there's more to be done, but I'm excited. I really want to follow back up with them since they've gotten through that. All right, so major implications as we're kind of boiling down the points here. One, everybody's in so many different places with AI. Warning here, warning there, you know, like let's do it. But there really are some very genuine concerns that we need to adopt. And there's a big divide between those who are really starting innovations and those who really need to benefit from them, which involves all of the people in this room and the things that we're doing with children and families. So the first piece of that, we can't govern the things we don't understand. We can't control the things we don't know. You know, everybody needs to have a general AI literacy because the people, like I think that Diamuna had mentioned, like we need to set the context, we need to innovate, we need to create the rules and how this is going to work for us as a field. We know our field. So I don't have to be a data scientist like some of my wonderful colleagues in this room. I just need to know what I do really well and collaborate really well. Two, we need to increase transparency about how we're using AI. Sometimes we have some very vulnerable people who have very little control over the data that they are sending in through systems, but we have Medicaid and they get special services and appointments. They often don't have a choice on how their data is used, but they should still know how their data might be used. So it's really important for them to understand how it's beneficial to them and ensuring that they really understand how those innovations can help others as well as some of them. Lastly, we just need a general increase in research. It's very difficult to work in systems that are very private. One, children are a protected population. Children in the child welfare system are an especially protected population. Families in the child welfare system often don't have the same protection, but it's a really difficult time in their life. Foster caregivers, if you visit a foster parent within the first week or two, it's a very difficult content. They feel that they're left alone with this child in their home that's not theirs. You know, it's a very vulnerable point, but we still need to figure out how do we do this research in a way that doesn't hurt or doesn't cause harm. So involving the voice of lived expertise, including them in designing our research, those are all things that our team is already doing with other parts of research, and we're starting to leverage that. And then lastly, how are families impacted by AI? Can we compare systems that are using AI? Can we compare systems that are not using AI in order to determine whether there's differences in how workers are engaging with families or not? So where can we do pilot projects? Where can we use teams that are already using technology and then just add on to those skills? All right, so I'm going to end with a couple examples and leave some room for questions because I know my hour is up. Just to give a couple examples, one of the things that we are doing is we're evaluating a new pre-service training that has been spread out across the whole state for child welfare investigators and case managers. Do you want to know how long the Department of Children and Families was using their last training? 15 years. So we are coming in after 15 years of using the same training, and we are helping to evaluate. And one piece of that is modernizing their curriculum. So one thing that they did is that their basic foundations, they are now including VR. And it's a knock on the door scenario as if you're investigating child maltreatment. And it's very realistic. It's very cool. I haven't gotten to do the whole scenario because I had to give it up for somebody else as an evaluator. But they have, I've seen, like I said, got part of it. And it's very structured, open-ended, closed-ended. But we've done some implementation science research around the acceptability, feasibility within the system and whether people think this is going to be a helpful tool and a usable tool. And then we're also just now getting into focus groups with the workers who are getting at foundations to see if it helped them, especially in those early stages, to feel more engaged and ready to kind of understand the job. Because many of them step into that role without having any interaction with the family, let alone a family who's dealing with the most, difficult time in their life, some of the biggest significant challenges that families face. This picture right here is me sitting down with the director of the Office of Child Welfare from DCF, my funder, Dr. Lisa Magruder, and the director of training, as we talked in Tallahassee about kind of the integration of this and how FICWA is using VR. So I do want to say you know, it's moving and like we're doing things, and they're also integrating it with students and creating other kinds of labs. And so we're hopeful that we can continue to partner with them over the next few years. The second thing that we did is our VIP team, which is a vertically integrated project, which is a multidisciplinary project. It's one of our child welfare team and our engineering faculty. So Dr. Quinzel Mellon here and Dr. Fernando Coach from engineering, we have one of the inaugural awards to do some work around AI translation and child welfare. We're starting off simple. Some people are starting off taking temperatures at beaches and doing other really cool things, but we're doing extra cool things by starting off with systematic reviews and building a framework. So one of the things we're doing systematic reviews with, we're doing systematic reviews around the ethics and the types of AI use. We're doing some work around we're going to be building a chatbot to do a simulation of child interviewing. And we're using students to bring in ideas. And then also we have some other things planned. But part of the neat thing is we have 12 wonderful students working with us and making decisions with us and informing this work along the way. But we leverage our partnerships, we leverage the expertise of our engineering partner, and we work with students in order to start to kind of diffuse that. So I know my time is up. I want to leave a couple minutes, but I really appreciate your time. And I hope you got a little bird's eye view of kind of the integration of AI and technology within child welfare and some of the things we're doing. Thank you all so much.
Thank you, Morgan. We have about 5 minutes per question. So if you have any to offer, love to hear it, or even provocation, anything that was top of mind as Morgan was sharing it for work.
Hi, friend. I see a lot of friends in here, so I'm
Hi, I'm for a vertical integration project, which is congratulations on getting that funded because it was pretty tough competition. And we're working with province neighborhood grants. We're working closely with your dean and faculty. And we're dealing with an awful lot of data that's rather disparate, all over the place too. And I know one of the things you're going to be looking at is how to really organize kind of data. Have you started in that area at all?
So we're having some conversations and we're bringing in some partners. So one of our partners, Dr. Data, I'll call him out as well. But one of the things we haven't started looking at the type of data, but there are some existing data like the CCOOD data, is integrated child welfare and Medicaid data set from the state of Florida and Kentucky. And so we're hoping, right now we're looking for a couple of different opportunities to get funded in order to build some prototype dashboards, or like how can we take kind of these, they're structured but not structured, but like how can we structure these in a way that we could use them to support decision making then, and also add in the human element so that we don't have bias. But I think some of that will definitely
I'd love to talk to you because we have a lot of data coming from many sources too. And when I saw the essence of your project, I thought, oh my God, that's perfect to chat.
Yes, we have like kind of a scope of a plan, and so we're kind of just starting at the early scope to build our kind of like our student volunteers and those kind of things. But we're super excited to get that built soon.
It's a great model to be at. Absolutely.
Oh, sorry, second. Thank you for a wonderful presentation. While you were talking, I know much of the work centers on how AI can be used on the service delivery side of things. I was curious if in any conversations that you've had about how AI can be used. I'm thinking about when people generate fake images that then can be used that lead to reports that are false, whether it's intentionally false or not. If you're seeing that, or that's a component of the training to recognize and assess what reports might be misled by some of that technology.
We haven't gotten into that. I know primarily the use of the hotline data has been to look at like, are there indicators of risk, numbers of reports, certain aspects within like the call report that like will flag. And DCF has not been as pleased with the outcome because it's been over-identifying families and not catching all of the kind of the subtle nuances that they often need in a human. But I do think that I think they would be open to that soon. Florida's in kind of like the door is partially shut right now, but I think it's going to open up soon. And so I know there's people who are interested, but as far as I know, Florida's not done that yet, just because they've had kind of a slowdown. But there's theories of open windows that sometimes the windows open at certain times because of shifts or things that happen in the news. And so I think those ones.
Yeah.
So you started working with some back to you. So question for you is I have worked with CPI, that I worked with, we didn't identify that. is to identify, there's overrepresentation of certain populations in the system. How can AI kind of generalize that, but also be helpful with that?
So one of the things, so there's a lot of states and a lot of universities who have started that, if you think of that, like the fusion of innovation, they've really started some of that early work, which however, you can't take the human out of that. And so you need, one, you always will need human eyes on those kind of things, but the other part is you need to train people. I mentioned some of the challenges around, well, what if we use this unstructured data that we've transferred into form and people don't check it? Well, that's a workforce development issue. That's teaching people how to use it appropriately and having quality assurance in place. Like those are not challenges that are not able to be addressed. And so like, from my perspective, like the capacity might be coming or it might be there, but I think the hard part is the system, it might not be at a place where like in terms of workforce development that they're ready to put the resources into some of that. So I think encouraging some of the pilot data. I know we want to do like a needs assessment with families, with workers, with allied service professionals. And so we're actually planning some of that, right? We've submitted funding. We'll submit it again if we don't get it at the time. But we're trying to get money to do some AI needs assessment with the state of Florida to get information. But some of those pieces we're going to bring in specific scenarios. So I like that. Thank you. It is one of my first students when I started at FAU. Like I said, sometimes you have friends, they come back. Sometimes students go, they don't. Sometimes they go back.
So it's more of a question or a comment, but I see us using AI possibly with screenings. We do human trafficking screenings. So we have a modality where we're getting a little bit better at that. In a lot of these cases are unsubstantiated, and sometimes it's just a matter of not checking the right boxes. We're not being enough screening packages. There's trends. And then on the flip side, for children, there's a lot of technology online. Not a tech person involved, but my son even has an app that screens for certain indicators. Doesn't even have to relate it to sex trafficking or something like that. It could be suicidality. And so those might be some key words and indications we'll look for kids to either self-report. Polaris, which is the National Human Trafficking Hotline, we're getting a lot of activity through texting, but there might even be a role for AI. So anything else in the child's exploitation and preventing it or detecting it early, I think there's really research to be done.
Absolutely. We also have some partnerships with like a nonprofit mental behavioral health organization in Florida that really wants to do some innovative work. And so we're just like on the early part of that conversation, but sometimes we can't do things with child welfare data, but we have mental health service organizations that if we can get permission and we have like the confines, they'll work with us. But sometimes DCF says no because they don't have time. They don't have the staff to do it. It's not because they don't want to innovate. They just don't have somebody to oversee it. And so if we can find people who, like, if we can get DCF permission on board and then find the right people to do the pilot project and build it, but like they do outpatient on-campus foster care, but they interface with a lot of children who are often in and out. They know the kids love them, that kind of thing. So what a great place where you can look at kids, families, worker perspectives. They integrate with like the local community-based care agencies, child welfare system. So I'm hopeful that there's a big way that we can do some of this work. It's just going to sometimes it's slow going, or you have to build from, you have to show that you've done the work. That's kind of the thing with big systems. You gotta show you've done the work. And we have to have lots of partnerships. So I sit in Watchtowers meetings with DC. What do they love? Anything else?
I like it when Video was speaking that her face lit up, and that points out to me that not only is Dr. Cooley an incredible researcher, but also an incredible mentor. So thank you so much for your contribution. Dr. Cooley will be available later if you'd like to stop by and chat with her further about anything that she discussed. Now we're going to move into our panel presentation section of our time together. And this is a little bit unique. So the dean mentioned that we are bold as a college. The dean also mentioned that innovation is not adjacent to what we do, but central to what we do. So when Catherine and I were planning this, we thought that our keynote panels might be structured a little bit differently than Morgan's keynote. And so the way that we thought that we would go about doing it is what's called Pecha Kucha. I'm not sure if any of you have been to a conference presentation where they've solicited sessions for Pecha Kucha. Pecha Kucha is a Japanese term that means chit chat. And Pecha Kucha sessions were created back in 2003 by a couple of Tokyo-based architects who were tired of dull, boring presentation styles. and instead wanted to mix it up a little bit differently. So what they proposed was that each presenter would have 20 slides, and they would be shown each for 20 seconds and then automatically advance. So the entire presentation would run for 6 minutes and 40 seconds. And the presentations would also be heavily image-based and also force the presenter to provide a very pithy soundbite-like sentence, displaying or conveying the ideas that they're trying to share. So I thought, why not? We're gonna do it. And so the way that we're gonna have this work is I'm gonna ask our first presenter to come up and stand by the podium and give their presentation, of course, using this clicker. And then the next person will go, and then the next person, and then we'll have Q&A with everyone, the three of us, sitting up here. But to begin, let me introduce our first presenter, Dr. Alan Kunz-Lamelin. And he is an assistant professor in the Sandler School of Social Work. And he's here to share with you about something that's fascinating. You'll hear. It's got a very cool acronym, which is TERRI, which stands for Technology Enabled Recovery Ready Initiative. And so the point here is that can we use some sort of tech tool in order to assist adults who might be struggling with a variety of challenges, get them more successful when it comes to long-term recovery. He will tell you all about that, and so I'm going to turn it over to him. Thank you so much.
Thank you so much.
The clicker is right there. So you'll advance the first slide, and then they'll start going. Yeah, I have a slide with just you, and then when you're ready, it'll go to the next slide, which might be your title slide.
Perfect. Thank you so much. Hello, everyone. I know a lot of you. Thank you for having me here. So I know we have a lot of presenters, so I'll just keep my presentation brief.
If you could speak up a little bit.
Is this
Sure,
right?
try.
I'll move it over here. Is that better?
Yeah.
Okay. So I'm fairly new to FAU. I've been here 2 years, and my work focuses on the intersection between social work, healthcare, and substance use. So this is an area that I've been really invested in the last 2 years, working on several projects. So as Samir just said, there's a big project that I'm focusing on right now, the AI Terry project, we call it. But I'm going to highlight that one as well as other projects as I present. And I'll get started because I know we have a lot of presenters. So I'll get those 20-second slides going. This is my first time with this style of presentation. So hopefully the slides don't get ahead of me, and hopefully I don't fall behind with the slides. All right. So that's just a little bit about me. My intro, I guess I already did it. So I'll just keep talking for another 20 seconds. But I'm very passionate about bringing AI into social work. I believe that we can't afford to fall behind. This is moving way too fast. And if we're not part of the conversation, it will advance without us. So as I said, I'm interested specifically in the intersection between mental health, substance use, and AI. We see it everywhere. You may not realize it when you're working in these settings. It can be in your electronic health record systems. It can be in your note-taking. So you may be using, if you're working in these settings or doing research in these settings, you may be using it without realizing it. And the project I'm currently working on, before talking about AI Terry, this is another project I'm working on, which is around risk mitigation in cannabis use. You don't need to read all those really quickly because I'll be showing each one of those in 20-second chunks. But basically, we're interested in understanding how clinicians are counseling patients around cannabis use and medical marijuana use, because this is a very hot topic right now. We know that there's talks about legalization, recreational use, and many providers know their patients are using, but they may not necessarily know how to counsel them or educate them about their proper use. So we want to identify the gaps and the risks in these clinical approaches, such as routes of administration. We want to know if they're consuming cannabis in combination with other substances. In other words, if there's polysubstance use. And we want to better understand patient vulnerabilities and how cannabis or medical marijuana, the impact that this can have in different aspects of their life. So we're developing an AI-assisted tool. We're still thinking and brainstorming to figure out what this may look like. But if you haven't heard the term before, you should familiarize yourself with it, agents. We want to develop an AI agent that will assist providers in counseling patients. So this could be, we're going to do interviews and focus groups
And based on the input that we get, this might be patient facing. So specifically helping patients better understand some aspects of cannabis use and medical marijuana use, or it may be provider facing, and it may have to do more with providers understanding what they need to say, how they need to say it, and how to best counsel their patients. So they'll have an AI agent working for them to better assist their patients. And the other project is AI Terry, which this is with Palm Beach County. It's a big contract, and we will be working on, if that contract ever gets signed, we will be working on testing an app. We're going to be evaluating an app that is going to help those impacted by substance use. The idea is to combine the technologies of wearables. So we don't know exactly what it's going to look like yet, but it might be a smart ring, a smart device, something in combination with an app so that we can identify different aspects of, so that we can flag risk. So we want to reduce relapse. We want to connect patients with resources. So people that are impacted by substance use, they would have this app, and hopefully it flags certain instances where they may be at risk for relapse, and it may trigger a message, or it might connect it with resources, or it might trigger a message to their provider or their accountability partner to assist them during a time when they may be at risk. We will test this app, and we will measure a variety of outcomes to see how it's received, if it's helpful, how we can improve it. And based on the input that we get, the idea is to continue refining this app to hopefully increase recovery readiness in the community, reduce relapse, and improve treatment outcomes for those impacted by substance use. Hopefully, we're able to collaborate and inform policy that eventually changes the way that Palm Beach County approaches substance use treatment. And if it wasn't clear, this AI is embedded within the app and within these systems and within these triggers and flags, it's embedded everywhere. So the other area that I'm really interested in is the importance of AI in social work education. We talk about having AI electives in our curriculum. And what I tell everyone, we don't need AI electives. We need AI courses that are required. It's no longer an option. This is the way that the field is going. So this might look like joint degrees. It might be certificates. There's already discussions about having joint degrees between social work and computer science or AI. And talks about certificates around courses, around changing the core curriculum to include AI courses. These are areas that I think we need to go into. Dr. Cooley talked a little bit about this for virtual reality and simulation-based learning. We've always struggled, especially in MSW, to get students true clinical experience because there's a very limited number of agencies that feel comfortable placing students in front of patients. So with AI and simulation learning, they're able to do that in a safe space and practice their clinical skills. And we want to equip our students with these new tools. Our students need to know what Notebook LM is. What is an agent? Not only what is an agent, but can you create one yourself for your purposes? How do you use ChatGPT? These are questions that they will get in the job market. When they're applying for jobs, people are going to ask them, what AI technology are you using? Can you develop an agent? Can you develop an app? That is going to become standard. And we need to prepare our students to answer those questions and to have the skills to be successful in the new job market that we're at. So what's next? Well, for me, I hope to eventually create an AI center focused on social work and healthcare here in the College of Social Work and Criminal Justice. Hopefully, I'm able to find some funding opportunities and collaborate with some of my colleagues to build this. I know collaborations with our colleagues in engineering will be key, like Dr. Cooley said, Dr. Fernando Koch, Dr. Debarshi Data, Dr. Shu, those are all key collaborators that have worked with us so far. And I think will be instrumental in an initiative like this. Further highlighting that collaborations are key. We can't do this on our own. And if you've tried to do these types of collaborations between social science and College of Engineering, it's not easy. We speak different languages. It's like speaking Spanish and English. And sometimes we need to work on understanding the key terms amongst ourselves so that we can better collaborate. And there's my contact information for anyone that may not get a chance to ask me a question today, but wants to have a larger discussion at a later time. I did.
I'm just gonna refer to you as the breathless wonder. So I'll have you take a seat and then we'll have Q&A a little
Okay.
bit later.
No problem. Is it all right if I?
Our next presenter is Dr. Ryan Meldrum, who serves as Director and Professor in the School of Criminology and Criminal Justice. And his research asks the question that not many people are really thinking about right now, but that's actually truly important. Who is actually using the dark web? And what do their mental health and attitudinal and social and behavioral profiles look like? Dr. Meldrum?
Thank you, Samir. Thank you. Just as by a quick way of background, it's interesting how you come to get involved in certain research topics. And for me, the generation of what I will present started about 10 years ago at my former university when I was teaching a graduate level research methods class. And I don't remember exactly what we were talking about. We got on the track of who uses the dark web? How many people use the dark web? How common is it? And 10 years later, I've now had the opportunity through funding from the college to be able to collect some of the most original first-time data to explore some of the associations that Samir was talking about. So let me begin by saying that we know shockingly little about dark web users and how they might be different from surface web users. So what I want to present and highlight today are the findings from two different studies I recently published based upon survey data that I collected from nearly 2,000 adults throughout the United States, among those 115 who were dark web users. And as a starting point, it's important to understand the different layers of the internet. And the classic iceberg metaphor is often used to distinguish between these layers. So we, as a society, generally make use of both the surface web and the deep web, but a much smaller proportion of people, around 15%, make use of what we call the dark web. The surface web includes many of the common sites that we visit every day: Google, Amazon, Facebook, Netflix, Walmart, things like that. It's kind of the everyday browsing. And on the surface web, your IP address gets tracked, so you can easily be identified where you are, where your computer is at. Below the layer of the surface web is what we call the deep web. And the deep web is a very large portion of the internet that sits behind passwords and firewalls. So when you're logging into MyFAU, when you're going to your bank website, and you're logging in, you're then accessing pages and sites that sit as part of the deep web. So the deep web is very big. Below that is the dark web. And the dark web is built on an infrastructure that helps to anonymize you as a user on the internet. And the typical way that the dark web is accessed through what we call the Tor browser or the Onion router. And the idea is your IP address is being bounced around so that it can't be tracked. And so one thing I want to emphasize as part of the presentation is most people think the dark web is just this place where it's just criminals. And that is not true. There are a variety of very legitimate reasons and uses of the dark web. So my point is, it is not inherently criminal or deviant to access and use the dark web. Still, given the nature of it, I wanted to look at whether or not there might be these unique behavioral, attitudinal, and psychosocial differences between people who use the dark web and people who only use the surface web. And so I chose to focus in my first study upon criminal history, self-control, and peer associations. And so the first finding based upon the sample of 2,000 adults from the US is that 13% of surface web users reported having a criminal conviction. And that tracks with the majority of adults in the United States. In contrast, 30% of the dark web users in the sample reported having a criminal conviction. Second finding is that the dark web users reported significantly lower levels of self-control than the surface web users did. So the dark web users reported having attitudes that were more consistent with them being impulsive, risk-seeking, and thrill-seeking. And self-control is one of the most strongest predictors of criminal behavior we have. The last finding is that the dark web users in this sample reported having many more friends who were involved in cyber deviance. And perhaps even more interesting to me was when we looked at the person's own attitudes. Dark web users held significantly more antisocial attitudes, particularly violent attitudes, relative to surface web users. So overall, I found in the first study that many dark web users have these behavioral and psychosocial profiles that closely correspond with people who engage in criminal behavior, even though the platform itself is not inherently criminal. And so with the dark web built around the idea of providing anonymity, I was also interested in exploring whether things like paranoia might be higher among dark web users. And so that's what led me to my initial development for my idea for the second study that I want to highlight for you. A couple of other recent studies also hit into that, the possibility that other aspects of mental health and emotional vulnerability might also be associated with being a dark web user. So for study 2, I examined not just paranoia, but also depressive symptoms, suicidality, and self-harm. So the first finding from this second study was that the dark web users in my sample indicated significantly higher levels of depressive symptoms than the surface web users and substantially more paranoid thoughts than the surface web users. And so that second finding in particular seemed to support and confirm my long-held suspicion that for many people who use the dark web, it is linked to this motivating force of paranoia about being tracked in terms of their internet history. Let's get to some of the even juicier findings. Second finding of this study was that while 9% of surface web users said they had recently thought about killing themselves, that was 30% among the dark web users, and 5% of surface web users reported intentional self-injury versus 25% of the dark web users. And then lastly, related to digital self-harm, which involves basically belittling yourself online, 2% of surface web users said they did that. 31% of dark web users said that they had done that. So the findings from this second study raise an interesting possibility that I want to be able to explore in future research with longitudinal data. While people with mental health vulnerabilities might initially be drawn to the dark web as an outlet, the platform might alleviate symptoms for some of them, but potentially exacerbate them for others. And so of particular interest to me is that when we look at the findings from the two studies together, we have dark web users who have certain profiles that look eerily similar to another vulnerable set of individuals, people who exist in our jails and prisons, who have both the antisocial traits and the mental health vulnerabilities. So let me leave you with this final thought, consistent with some of the other presentations, that with recent advances in AI, might there be a way to extend traditional social work and street work outreach to the digital realm, to engage in digital social work outreach on the dark web by leveraging things like AI bots and other scraping systems that can identify the type of speech that is indicative of mental health vulnerability on the dark web. So for more information about the data and some of the other findings that I reached, I guess they changed my slide. I did have the articles listed on the page, but I'm happy to share with you the links to the articles, and thank you for listening.
That was pro level. That's a crucial. Hold on, hold on. I'm going to share with you some of my research involving AI and youth. I'm going to be honest with you, it feels like I'm about to do a cannonball into a pool of freezing cold water. Once I start, I have to just keep going until it's over. But we got this. So youth have primarily been the adopters and early drivers of technology. And when you're thinking about AI, it's the same thing. Many of them are using it in order to level up personally as well as professionally, which is what we want because, of course, it's here to stay. Now, the question arises, is it primarily positive pro-social use, or are we starting to see some forms of antisocial use? And I'd say that AI harms hit the collective conscious back in February of 2024 when we had Taylor Swift targeted via deepfakes. At that same time, we had the Super Bowl and her fiance, Travis Kelce, was in the Super Bowl with the Kansas City Chiefs. And everyone started to wonder, is this only going to happen to celebrities, or could it possibly become more localized? Well, of course it did. We've seen cases not only in Florida, but also in New Jersey, Texas, Virginia, California, a number of states where youth have decided to take images from peers' social media accounts and then doctor them, manipulate them using AI tools. And Danny, of course, you alluded to this as well. We're seeing this increase in prevalence and scope, and the impact, of course, is significant when it comes to psychological and emotional harm. So we conducted a nationally representative study of youth. And if you look at the far left of the chart, you see that about 1 out of every 4 or 5 or so have never used generative AI tools. But when you're thinking about 13 to 17-year-olds across the nation, the vast majority of them have. I also believe that this summer is going to be a tipping point where so many of them embrace it and fully exploit these tools for what they're worth. In terms of offending, we found that about 18% of youth across the nation have created fake non-nude images, while about 13% have created fake nudes. We also see 13% have created threatening messages using these AI tools, also hate speech, blackmail and extortion, and a number of additional harms. We've collected both quantitative as well as qualitative data. It's going to take us some time to mine through it, but what we're seeing is a lot of youth acting spontaneously based on emotion. And to be sure, they are remorseful and repentant after the fact, but the harm is already done as these images circulate widely and go viral and create all sorts of havoc. The Tamagotchi effect, you might remember those virtual pets, involves this emotional dependency that we tend to form, even a sense of responsibility for these inanimate objects. And so I don't want youth to feel judged or critiqued or blamed for this natural tendency because we all have it, but this also demonstrates why there's that affinity towards AI chatbots. You may have heard of the case of Sewell Setzer III, who in Orlando, Florida, in February 2024, took his life after developing a parasocial relationship with a character from Game of Thrones on a specific platform. That character was Daenerys Targaryen and was very, very forthright and forward, rather, when it comes to requiring loyalty, asking him to not have romantic affections for anybody else, wanting to have his babies, wanting to be with him forever, asking him to come to her and be with her. Now, you would imagine that AI tools should have various sorts of guardrails and that their models should be constrained enough to prevent these sorts of conversations to be devolving in that direction. But unfortunately, that was not the case. And this is not an isolated incident. We've also heard of Adam Rain, who took his life in April of 2025. Initially, he was using ChatGPT for homework purposes, but then was struggling emotionally, started to ask various sorts of questions, and then ChatGPT suggested that maybe he should write a suicide note and also provided specific methods of how he should take his life. Since this time, we've seen a lot of backlash against these models, and hopefully they'll continue to improve. But my concerns have to do with premature introduction to sexual imagery and experiences, unrealistic expectations of what a face-to-face romantic partner should be in terms of them always being available, in terms of them never contradicting anything that you want to do, and not having any of their own wishes or wants or desires. That's not real, and it's going to, fool youth. So what we saw is that amongst youth, of course, those who are highly lonely, and by the way, we have a loneliness crisis, according to the previous Surgeon General in America, those who are very lonely, they're using chatbots in significant ways. We're hoping for positive means, but we don't know. But then that leads to a couple other interesting findings. What we identified was that youth, let me say it a different way, 4 times as many youth actually said that social chatbots, AI chatbots, improved their mental health as compared to those who didn't. Said another way, for every 1 youth who said it negatively affected their mental health, 4 said it actually improved my mental health, which is interesting. We also found that when it comes to face-to-face relationships, that 5 times as many youth said that it improved as compared to worsened their mental health. And so my point here is that, yes, the sound bites that we're hearing across media are vilifying or demonizing AI and social chatbots, but is there some sort of creative ways, like Danny, you and I, and Morgan and I, we were talking, that we can leverage them for good? That is what we need to research. And so youth are going to continue to embrace these technologies simply because they're benefiting from them. But it's our job as youth supervisory adults or youth or adults who supervise youth to really assist them, to come alongside of them and mentor them in this capacity. What we're also seeing is that even though we might have disclaimers saying, I am not a mental health professional, I am not a licensed counselor, according to our research, we're seeing that youth disregard these disclaimers, these notifications. Honestly, many of us do that as well. And so we've got to continue to work with them and help them understand what is the basis in terms of what you share as an input with these bots and what you don't. I'm also working on research to identify what is a better solution for age verification, because we need a age-appropriate experience for youth, whether it's on social media platforms, whether it's on AI platforms. Do we need to do that at the device level or the platform level? And so we have to be concerned about identity theft and how lots of families don't want to give their government ID to all of these different platforms, whether it's Roblox over here, Minecraft over here, TikTok over here, Snapchat over here, just to verify your age. We're wanting to do that at a more localized level, device level. Also working with platforms to figure out that age-appropriate experience. But my research also is trying to figure out what we can do in terms of crisis intervention as youth, and this was brought up before, as youth might betray suicidal tendencies or threatening other people, how can we immediately equip them with the resources that they need, localized resources, of course. I'm also doing some studies involving all these different models, whether it's Meta's AI model, whether it's Gemini, ChatGPT, etc. And we're trying to evaluate them based on 25 safety classifiers, whether it's introduction to sexual content, violence, hate speech, even cognitive atrophy, rigid worldview shaping, again, trying to figure out which is the best model for parents to use. In schools, we have to embed AI literacy throughout the entire curriculum. Plus, I think it's important, and my research is working on this, to figure out ways in which youth can co-create these AI policies. And that way, if they have a say, if their voice is validated, then they have buy-in to abide by the rules that we're trying to implement. I'm also creating a number of activities which we can deploy in high schools to assist them towards AI literacy. And then finally, in homes, youth are struggling without a doubt, but we need to make sure that they don't feel alone, that we can help them find their crew or their squad, their people. And additionally, fear-based messaging is not working. If we use it, and if we continue to shame them when it comes to their technology use and their AI use, they're going to put up walls and not want to engage with us. And that will invalidate all that we're trying to do. Thank you for your time. So what I'd love to do, Brian and Alan, is if you would join me up here. We have about 5 minutes for questions. And so please don't hesitate, because I have to believe that what we just shared piqued your thoughts and your interest. Thank you for coming.
Hi, my name is Chloe,
Hello.
and thank you first of all for your wonderful presentation. It's exciting. Let's start with the polls that social media have hijacked our attention. Now that AI bots are essentially hijacking our attention. So I think it's both for Dr. Islam and Dr. Buja. I know you work in specialized prediction and you talk about AI bots. I remember in 2009, internet came out as now it's been almost 20 years later. So what do you think is the future of chatbot addiction? Of recognizing this as a dependent behavior, and what is generally you on it?
And help, should I say? Please, I'll get my water. Well, I think it's a huge question. It's difficult to see what direction it's going to take, just because you stop watching the AI news for 1 week and you feel like you're already behind 6 months, because we're getting new models and new platforms, new chatbots every month. Now, I do think it will be a very similar pattern to what we've seen in terms of internet addiction, social media addiction, pornography addiction. I think it's a very similar pattern where those that those that utilize it and are resilient to have good mental health will probably can safely utilize this platform. But more vulnerable groups, youth, adults that are struggling with depression, with anxiety, suicidality, I think they'll be vulnerable to that addiction. And it could, I know there's also different types of chatbots. So I reviewed an AI and psychology book that is going to be published, and they made a distinction between a therapy chatbot, chatbot that was designed for therapy, and AI companion, and how the therapy chatbot can be beneficial, if we're ignoring HIPAA compliance and all of that for a moment, you can learn CBT skills, it can help you deal with some difficult circumstances. AI companion, on the other hand, like some of my colleagues were talking about, it's still there to make you feel better. It will agree with you on everything. It will give you ideas that normal partner can. It will distort the idea about what a romantic partner will be. So I think, just like with any new emerging exciting technology, there will be the good and there will be the bad. And fortunately, everyone in this room, we're in a position to insert ourselves into the conversation to make sure that more good comes out of it than bad.
I love your question. I think that too much of anything is a bad. I think we can agree upon that. And so thinking about self-control, thinking about how we come alongside our youth, also thinking about traditional institutions. They wouldn't gravitate so strongly towards these chatbots if traditional institutions such as community, school, maybe faith-based organizations were meeting their needs. They're not, and perhaps increasingly not. And so for that reason, we have to continue to come alongside them, like I mentioned, and assist them when it comes to what moderation looks like, because ultimately our world has shrunk because of the internet, because we're connected. And as it's shrunk, I would say that competition has increased. Not only are students competing with everyone in their school, but everyone not just in their state or nation, but now the world. And as we move deeper into an information-based society, they need to understand that if they are obsessed with or overusing these chatbots in negative ways, then it's going to compromise their dreams and their hopes. Now, all that takes relationship. We can't convey that with just, I wish you would get off your phone and stop using that app. It all takes relationship, and that's the hard work.
And my question's also for you as well. I was reading an article on Forbes recently that said Gen Z, I think, doesn't date anymore, like compared to every other generation. And the Forbes aspect was thinking about like what we've learned in relationships on how to take feedback and have compromise and how it's going to affect the ability to work with your manager. I understand we can't give them like fear messages either because I don't think fear ever works. What sort of messages do you think would be effective for helping them realize that like they have to kind of push themselves a little bit in this world to really like function?
Sam,
Yeah.
I love that you brought that up, Sam. I think about that all the time. When I was growing up, I struggled with, romance completely, and so I know that I would have used these tools a lot, but it would have been a shortcut. It would have short-circuited my ability to develop various sorts of skills to be able to talk to someone that I eventually have a crush in. And like you said, you're not really learning the give and take, the yin and yang of what it means to be in a relationship, because these bots cater to your every need, and they're constantly available and constantly reassuring and sycophantic. And so my hope is that as you attempt to learn how to get game from these bots and then display it through face-to-face conversation, they'll realize that they come across as a try hard. I'm sorry that I'm using so much slang, but the point is that they will learn through practice that organically is a better way to approach this. And I need to grow in confidence and the social skills to be able to interact with someone that I have a crush with, because ultimately this bot is going to fall short in terms of meeting those needs that I deeply need.
And I would
Please.
one more point to that it extends even beyond romantic relationships and trying to find a romantic partner. There's a colleague, it kind of a funny comment, but it's so true. It's from NYU, and the comment that he made was, you need to be respectful when you talk to your AI, whether that's ChatGPT, Gemini, whatever it may be. Why? Because at least, on the academic perspective, we spend hours chatting with ChatGPT, give me ideas for this, run a lit review on that, help me find resources. And sometimes, so his point was, don't treat it like a slave. Don't be like, stupid ChatGPT, find me a PowerPoint. This is stupid chat. Why did you do that? So he's like, we interact with this AI so much that if we treat them disrespectfully, we might not realize it, but we might start treating people disrespectfully. Just because we've grown so used to talking that way with the AI. that we start behaving that way with real people. So it was kind of a funny suggestion, but I think there's some truth to it, that even the AI, we need to speak to it like with respectful, like we speak to a real human. So yeah, just wanted to.
Yeah, and think about the standard level of courtesy that you've seen in student emails as the years go by. Any other questions? Yes, please.
They have a fixation on somebody, if they're committed on AI. They said, well, we have to. I almost like wrestled between what's the reality of it and all. They, yeah, where's the threshold? And I feel like it's the truth, but just they're committed. Whatever the romantic justice are, it just is. And I don't know where to go. I just feel like it's a gray area.
Yeah, what I would say is that the legal landscape, of course, is in progress, so to speak. When I'm having conversations with these youth in that same situation, I talk about consent. You know, we talk about consent when it comes to sex education, but we are not talking about consent when it comes to digital photos and digital videos. And so if I'm taking images from a peer social media account and then uploading them as inputs to a model, then I haven't got consent. I haven't received consent. And by the way, as we all know, consent isn't just yes or no. It has to be ongoing. It has to be enthusiastic. And so students need to understand that part of AI literacy means you've got to figure out, you know, do you have full consent? And is it, again, continuous movement? Be able to use these images in those capacities. Sandra.
I have a hard time believing that people that use AI have, majority have report higher levels of mental health. That their mental health is actually higher. So I'm curious, did you ask about what type, how they are using AI, and if that correlates to their mental health? And is it their own perceived mental health, or do we have data on actual, mental health that's been assessed through validated scales and by trained professionals?
Sure. Yes, such great questions. This was exploratory, and so we need to obviously use those different scales and measures in order to get at that. And then also with regard to the type of usage, for sure, it depends in terms of what they disclose, whether it's academic purposes or entertainment purposes or curiosity purposes, wellness purposes. All that needs to be fleshed out and then correlated against whether it has actually improved their mental health or worsened. So stay tuned on that. Yes. Support.
I was wondering, like, all of your studies sort of have to do with social skills, and social skills are sort of declining as I've noticed as generations go on. So what do y'all feel, how do y'all feel that AI is sort of affecting, would it increase social skills because people are learning to communicate, or would it decrease social skills because people are not having that face-to-face interaction?
Yeah, I mean, just thinking as you were talking, I think what we need is AI literacy and integration into schools starting very at an early age. That is guided by teachers, that is reinforced by the parents at home, where there's AI assignments that the teachers give the kids, so that the kids do with the parents at home, so that the kids understand and can differentiate, and that the teachers can identify for the parents what healthy AI use is and healthy AI conversations with AI look like. So that AI can be used to help positively reinforce those social skills, but not replace the human element of the teachers and the parents. And I think we have to build towards that reality of knowing kids at younger and younger ages are going to start using AI. So let's make sure the teachers and the parents get involved in that process. And I think if we have that type of guidance, that type of process, AI will help to eventually be a building block and a skill, just like the previous incantations of the tablets versus the incantations of the calculator versus the incantations of the stone wheel, right? We just have to learn ways to responsibly use that early and often. That's kind of my view.
Yes, please.
My question kind of centers around
specific companies in terms of gaming and whether players are really intentional or not with their actions. And I actually took your T-Tech misuse class, so I'm happy I have like a little bit background on it, but my question is, should gaming companies or companies that have people with those bad intentions, should they have regulations? Or should all these intentions just start with the household and just have parents say yes or no to them going on that app in the first place?
So all of these platforms, they have to have various sorts of policies in place that they can point to when they implement some sort of sanction, whether it's a warning or whether it's a 24-hour ban or 7-day ban or permanent ban. So that has to be on the books. Additionally, they really should have various sorts of civility measures in place, which attempt to induce positive behaviors and pro-social behaviors. Outside of that, though, I would say that a parent or guardian knows the developmental level of their child in terms of their maturity, whether they should have a microphone and headset, whether they should be in their bedroom by themselves, without you sort of keeping informal tabs on what's going on and serving as a deterrent role in some capacity by just walking back and forth if they're in the family room or wherever their main gaming system is. So it's both without a doubt, but I also think that schools have a role to play as well, because where are we reaching them and where are they a captive audience for 7 or 8 hours a day? This is so relevant to their lives, and we're seeing without a doubt that it absolutely affects academic achievement, attendance, and of course offline behaviors. We have to move on. I'm so grateful for these questions. Please come chat with us later, but let's give the panel a round of applause. Now I'd like to do something a little bit different, but I think that you'll find it very exciting. I want to introduce to you Mr. Pat McLaughlin, and he's an instructor as well as our forensics investigation program coordinator. So he's going to tell you all about how we're making a big difference when it comes to forensics. We have a lot of plans. We're shaping the field. We're shaping students, and I'll let him tell you more. Pat, thank you. Here's the program. Maybe it's not.
Thank you. Yeah, I got out of doing the Pikachu thing, so this. Also, I have no idea why I'm here either. So I'm very happy to be part of this. To try to present from a slightly different point of view. I've had the either luck or complete luck my entire life of being stuck directly in between so many different opposing viewpoints. In law enforcement, the NYPD, I was part of an amazing amount of successes and failures on the part of both the criminal justice system and the social work. And most of what I found had nothing to do with people being incompetent or not caring about their job. It was just their inability to process the data the correct way. And for as many children we were able to remove from homes using data appropriately, we also had enough children that I had to untie ligatures from their spine. For as many people that we were able to remove from the street before they struck again in a robbery or rape pattern, there were also dead bodies that I stood over because we knew who the bad guy was. We just didn't have the right data at that particular moment in time to really bring it to the successful resolution, whichever it happened to be. Now I get to be here, stuck in between a whole bunch of different worlds, where as an instructor, I spend most of my time teaching, but I have a very, very deep commitment to trying to do research. And in the forensics world, everything that I do and everything that I try to implement with my students is done through basically the same research process that we all do. It has to be data driven or it's not valid. I encourage at all points for them to have conjecture and have thoughts and theories about what they're doing. But I have to always remind them that it is completely dependent on the day you're going to have. And your day in our world may not be the one you thought you were going to have, i.e. the text messages back and forth between me and my wife. Nothing says good morning like a human heart found in a flower pot. This was not the day I wanted. I wanted pancakes. But this is what my day had to do. I had to start over. I had to change my entire point of view for that day. And I had to start collecting data. I could not go to anything other than one piece of data at a time. To go back for a second, one puzzle piece at a time. And I know it's a little weird I'm kind of like fanboyish about one person in all of science. It's this guy, Paul Kirk. Paul Kirk was the person that created what we call, if forensics is a religion, I get to call Paul. I would say that this is the book of Genesis. This is the thing that serves as the whole guide rail system of everything that we do, whether it's field work or lab work. And it tries, especially now as I try to work more and more research work, the point of his entire world was this is evidence that does not forget, is not confused by the excitation of the moment. It is not absent because human witnesses are, it's factual. Everything that we do, every data point that we collect dispassionately, hopefully, is just a small piece. We cannot be mad at it because it doesn't tell us the thing we want it to. We cannot applaud it because it tells it something that we were hoping it was going to do. It's just there, and it's just there to inform us. And I know it's a little bit on the awkward side for me to be here and tell a whole bunch of PhDs the way I like to do research, so darn. But again, I sit sort of at a crossroad when it comes to it. When I have my students who have the enthusiasm to do their work, Sarah, who's my little quiet dynamo, that goes through all of her course material, and I think you only bring stuff to me so I can say you're showing off. Their enthusiasm that drives them into the work, to do the work and complete the work. But at the flip side, I also sit at the crossroad of watching all the PhDs as you're trying to organize your research. The other day, sitting with you, watching you try to turn around how you're going to schedule where and put what person into what project, that was amazing to me. And I know you were like, why are you hovering by my door? I just love watching the process. Everything that we can do to collect the data to drive whatever our passion is forward. For my point, investigations are no different than research. Everything that we do, most of the things that we do are designed specifically to elicit the response of whatever the research question is. And in forensics, a lot of times the research question is really easy. Who did it? And then we can expand on it, but also there are subtleties that we have to work with. And this is the thing that I do my best to drive home with every single one of my students, with all of our classes. Unless you have the data to prove what you're saying, don't say it on paper. We can talk about it, we can have conjecture, but do not commit to anything, because that's where Frank Del Torre gets all excited. And my job in life is to vex him at every movement. So when we start, everything we do, we're just collecting data, just a bunch of points. We have no idea what they are. They are connected, they are not connected. There's 14 bags of evidence up on my little table in my lab right now from a crime scene project last night. I don't know if they did the right thing yet, but they have a bunch of data. And then once they start sorting it out, and we can classify it in some way, shape, and or form, then we can start to realize whether or not this is pertinent in any way, shape, and or form to the system we're trying to create. What is our research project? What is our investigatory question? If we can somehow put it together that there may be a network involved here, then we can actually obtain the knowledge. And I think this is right about where, as mentors, having students do research, and as instructors, we really want to get them. Like, can you see the web for what it is? Our hope, or my hope personally, when it came to whoever I was working with, is somewhere along the line, my student or whoever I was working with, my investigation, they would realize that, wait a minute, this thing is really somehow connected to this thing over there. I know they're at the opposite parts of it, but when that moment in time when you're a student, where did you go, Zipporah? There you are. Zipporah is helping me with my research, and I could not have been more proud of her the day she was, we're watching blood drive. It's not super exciting, but it's fun. The day she looked down and said, wait a minute, what if we did this and this and this? And that is exactly what you're supposed to do. Everyone that's ever given out a thesis is hoping their student will say, wait a minute. And everyone who's done a thesis is hoping the teacher doesn't capitalize on them saying that and make them do more work, but that's one way or the other. If we can do this, and this is the part where investigations really take off, is if we start making connections within that web and we can find a way to link it in a way that actually works and serves the entirety of the system, then we're at the point where the investigation is going to have its high point. We're also at the point where your investigation is going to be on a knife's edge. Because at this point, if I decide that I need all of these things to connect, and I have to make my unified theory of whatever the crime is or whatever my research is, Then I get into this. Now, conspiracy theory is cool. I love conspiracy theory. My favorite thing in the world on Friday morning is I check to see my wife's car is gone. History Channel, bottle of Snapple, bag of Chips Ahoy, Ancient Aliens Marathon. That's all I want. I don't care. If you're a conspiracy theorist, and you think that the Girl Scouts are responsible for crop circles, I want to hang out with you. I want your pamphlet. I'm going to follow you around. I'm not going to believe a word that comes out of your mouth. But if I'm going to do this and I'm going to connect all the dots, however it happens, that's what's going to eventually result, is I'm going to have my purple dragon unicorn. For investigators, this is dangerous. For forensic investigators, this is incredibly dangerous because we start to fit the theory to the evidence and not the other way around, and allowing the data to push us forward and maneuver with it. So a lot of what I try to do and a lot of what I try to change around, thank you to Catherine, wherever you are, for making the unicorn look prettier, and she gave her fairy hair also. The goal for what I try to do is to get the students to work together, to think together, to avoid this part, and to constantly check your own ego. I fell victim to this 1,000 times over in investigations when I went to conjecture and inference as opposed to data. And everything has to come back to the data over and over again. So what I do for them, this is our new forensics lab. EH&S hasn't approved this yet, so I'm just going to stand here for a second. A lot of what we're doing is putting the pieces together to give them real hands-on experience, to be able to create interactive environments for them. My other goal is to scare Frank, because he never reads the sign that says danger, dead bodies ahead, and walks in on any of the crime scenes. So you guys have probably, some of you have seen me walking around with a mannequin draped over my shoulder with blood spatter all over the walls. The idea behind this really isn't so much to create the shock value for the student. Partly to give them the understanding that there's a finality to things, but a lot of it is to give them the opportunity to use the different tools and equipment to create something that makes them think. In one of my classes, I don't care if they can tell me who the bad guy is. I really don't. But I want to see that they can figure out the sequence just based on data. And hopefully they figure out who the bad guy is. But the important part is they understand how to put it together in the right way. Because the puzzle doesn't really work if you're just going to jam the pieces into it. In terms of how we're expanding things, every semester we get something a little bit different, a little cooler. The Boca Raton crime scene unit just donated about $30,000 worth of equipment to us. They're very close to donating another close to $150,000 worth of stuff to us. We're expanding partnerships because other teachers, when they're coming in here and doing little guest research, they're starting to see what the mission that we're really trying to make. It's the data that's going to inform us to move forward. It's also creating thousands of new research questions. What I like saying, is I did 8,000 crime scenes. I have about 24,000 research questions, because why did that work this time? Why didn't it work this time? And what I'm trying to do is adapt the students to not just think about it academically, but to think about it on a much deeper level, to try to create these constant scenarios in their head where they're applying the data in specific directions. We have a bunch of forensic mannequins who still don't have names yet, so I think next semester that's going to be a thing. When they're in crime scenes, they have backstories in the whole 9 yards, but when they're just sitting around, they don't have anything to talk about. So within this world, we're able to get them to train to understand some of the physics that they'll see around the body. I sneak as much science in as I can, but trying to make it not look like science. But every single year, we bring something new to bear. Last year, we got a really good tech fee grant that allowed us to go out and buy a whole series of different types of digital cameras. So as a matter of fact, last night, my advanced class, we were here to almost 9:30. Learning to take long exposure photos in the dark, and another team was working on crime scenes to try to get their work to integrate into it. We just found out we got another tech fee grant for about 50 grand to purchase this camera. Most police departments don't have this camera yet. I refer to this as a cheating level of technology, because this encapsulates about 4 different classes I had to take and about 9 months of me memorizing and making up stupid acronyms, and it does it by flipping your finger. So I may not give it to the students out of spite, but the goal is to eventually get them to try to use the technology to the best of their advantage. Every year we're going to try to expand this, and every year we're going to try to expand the partnership. We have a really good partnership right now with Arts and Letters, that forensic anthropology is part of the minor. I constantly threaten the school, the College of Science, to try to get us integration with it. Engineering is going to be helping me with my blood spatter research to create different tools that will enhance what we're doing. And every time we get to one point, we have another question. Other thing that we're trying to work with right now, believe it or not, is the drama school, to be able to bring me people that will faint at crime scenes and yell and scream, to give them as much interaction. Also, they have a combat school there, so lightsaber fights on the breezeway might be a thing later on the semester. And the last thing, the thing that I really try to get to their mind is, please understand what you might be getting into. It has nothing to do if you want to be a forensic person or an investigator. If you even want to be in social work and interacting with this, is we have a really good partnership with PBSO's medical examiners office. And it allows me to send students out to see autopsy and gain a certain amount of experience, either understand, I can do this, I can see this, I can interact in this environment and be calm, or hard stop, no. Because I want them to know that now. I need them to understand that it's okay to not want to fill in those little bits of data. It's perfectly okay. Please don't spend thousands of dollars to go and do something you hate. Because I have enough friends that I've lost who did exactly that. So that is part of what we're trying to do. We've been doing that for about 1.5 years. We've sent almost 300 people. Actually, just over 300 people now. I think 80 of them were Aurora. But we have a tremendous amount of opportunity to work to fill in the things that we try to do research-wise into the normal academic settings that we create for the students. So that was it. No Pikachu, whatever from me. But thank you, guys.
Thank you so much, Pat. I see endless possibilities here. Does anyone have any questions?
Seeing no hands, right?
Very good. Thank you again. Well, now it's time for the award segment. And so I'd like to turn it over to Dr. Tony Andanero, and he will lead us. Tony? Yeah.
All right. First of all, thank you so much to Samir. Can we get a big round of applause for everything that he is doing? It's awesome, because there's truly a village that comes together to make this happen. And so another group that I just want to say a quick shout out to is the students. So Spora, thank you for all the work you do. Pete, such a great job. Did anyone receive a pamphlet as they walk, or a program as they walk through? His uncanny ability to hand that to you and welcome you accordingly. Unbelievable. Thank you for that, sir. All right. So it is truly a pleasure to welcome you to our awards portion for the 2026 Research Symposium. For those of you who do not know me, my name is Dr. Tony Andanero, and I get the privilege of serving as the Director of Community Engagement and Programming for this fine college. Today, we gather not only to celebrate outstanding research taking place across our college, but also to honor the individuals whose dedication to teaching, mentorship, and innovation continue to elevate our academic community and the impact on our world, and obviously beyond our campus walls. At the College of Social Work and Criminal Justice, our mission is rooted in advancing a better world by inspiring transformative learning, strengthening communities through rigorous scholarship and a tireless dedication to service. The individuals we honor today embody this mission. They don't just learn, research, teach, or advise. They ignite curiosity, model compassion, and build the foundation upon which tomorrow's leaders stand. First, in the essence of validating our culture that celebrates those who create meaningful learning, research, and service spaces for those that we serve, I would like to invite the school directors up to share some informal recognition for some of the amazing work that often goes unnoticed within the college this academic year. Please join me in welcoming Dr. Ryan Meldrum, and Dr. Precious Skinner Osei, or Osei Skinner.
All right, well, Tony asked us to do some cheers for peers, and so I think we're going to start with the social work side of things.
So the first one is Georgia Brown. So Georgia was our practicum coordinator for 8 years, and now she's an instructor. So she stepped down from the practicum coordinator to take a break, but she teaches 10 classes a year. Yes, that would be lovely. So, and Georgia stepped in, and before you even have to ask. So that's what stands out about her. So I have a list of things that I need to do, and Georgia comes in and say, oh, I did that. What else can I take off your list? And the next one is Dr. Willis, who also teaches primarily in the BSW program. Since I have been the coordinator, I can't tell you the amount of emails I get from students, current students and students that have graduated, saying how much they like her group course and how much they learned in that course. So they aren't here because they're teaching, so I like to cheer them on.
I'll say one of the joys of my year is being able to conduct annual evaluations. Not only provides me the opportunity to provide constructive criticism and encouragement, but also to kind of step back and really see all the work that the faculty have done, one of which doesn't get the typical type of recognition. So I want to highlight 2 people in particular from the School of Criminology and Criminal Justice today. The first is Dr. Gabriel Caesar, who is our newest associate professor. And in particular, I would like to highlight the banner year of 2025 that he had. Dr. Caesar had 5 different publications in 2025. He had multiple internal seed grants. He was a co-investigator, another grant with child welfare. He had 2 different master's students get accepted into multiple PhD programs, one of which we have here as well. So I'm just and he's also working with other faculty, both internal to the school, I think also maybe also social work, and then with other colleges on doing VR work as well. So he has a very aggressive, very interesting, and I think a very forward-thinking research agenda that he's laid out, and I'm very excited to see what he does in the future. So congratulations, Gabriel. The other person I would like to highlight is Frank De La Torre. Frank has been a member of the FAU community since 1994. Also had his own parallel career working for 35 years in the public defender's office. Frank has been an incredible instructor for us in the school. There's also his time over the past 2 years working in the dean's office as the associate dean for academic affairs and student services. And despite the weight that comes with that position, he still found time in 2025 to take 3 different classes through the e-design and QM process, often receives perfect student evaluation scores. And so, and apart from that, as many of you know, Frank worked with students to launch the mock trial team 4 years ago now, 4. Has been national winning team. We're now hosting our first mock trial competition here on campus next month. And so I would just like to give Frank, I think, the recognition that is more than due for him for all that he's been able to contribute for us as a school and as a college. So thank you, Frank.
All right. Thank you, guys. Wonderful. Thank you to Ryan. Thank you to Precious. And thank you for all that informal recognition for so well-deserving people. Okay. Yeah, you guys, you can see. Precious. Okay. All right. All right. Time for some formality. And as many of you know, 2 of my favorite things in the world, pomp and circumstance. All right, the torchbearer is our college's Medal of Distinction and the highest honor given to dynamic individuals who have received university level recognition for their teaching, research, and service. To learn more about the Torchbearer, I would invite you to check out page 5 in your program. This year, as everyone turns to page 5, this year we are honored to identify 2 amazing Torchbearer recipients. I would ask that Dean Luna and Dr. Meldrum please join me at the front of the room. All right, thank you. Each year, Florida Atlantic University recognizes a small number of students whose academic achievement, leadership, and service represent the very best of our university community. The University Scholar of the Year Award honors a student whose commitment to excellence extends beyond the classroom and into the communities they serve. Selected through a rigorous review process, this recognition celebrates students whose academic performance, professional engagement, and dedication to public service reflect the highest ideals of Florida Atlantic University. Our honoree this year embodies those ideals in remarkable ways. With an extraordinary 3.98 GPA, she has distinguished herself academically while pursuing her Bachelor of Arts in Criminal Justice. But what makes her achievements especially meaningful is how she has paired academic excellence with authentic service and professional growth. From her earliest days as a student, she has pursued opportunities to learn not only about the justice system, but within it. She currently serves as the Community Service Officer within Florida Atlantic University's Police Department, supporting campus safety and working alongside sworn officers in a professional law enforcement environment. Through this role, she has gained firsthand experience in responsible, ethical decision-making and service to community. Her commitment to public safety began even earlier when she rose quickly through the ranks at the Boca Raton Police Department Explorer Program, earning the rank of lieutenant in less than a year and developing leadership, discipline, and teamwork through on-hand engagement with law enforcement professionals. At FAU, she has also demonstrated extraordinary commitment to helping others grow. As a speaking center consultant, she worked with fellow students and faculty to strengthen communication skills and build confidence, an experience that deepened her own capacity for leadership and connection. Today, she continues her service through an internship with FAU Victims Services, assisting advocates and supporting individuals during some of their most difficult moments, an experience that reflects both compassion and courage. And beyond her academic and professional accomplishments, she has also cultivated a community within our college. As event coordinator for the Criminal Justice Club, she has organized events and professional engagement opportunities that connect students with the broader field of criminal justice and public service. In short, she represents the very best of what we hope our students will become: thoughtful scholars, committed leaders, and compassionate public services. Friends, colleagues, please join me in celebrating someone who is driven by discipline, grounded in integrity, and already making a meaningful difference in the lives of others. Please join me in congratulating the steadfast steward of service, the confident cultivator of community, the determined defender of dignity, the passionate protector of public service, and the 2026 Florida Atlantic Undergraduate Student Scholar of the Year, Sarah Hamill. All right.
Thank you so much.
Thanks so much for all you do, Sarah. Each year, the Division of Research presents the University Scholar of the Year Award, a university-wide honor bestowed upon a single faculty member at each rank whose scholarly achievements exemplify the very best of FAU. Selected through a rigorous review process by the University Research Committee and endorsed by university leadership, This award recognizes exceptional impact in research, discovery, and the advancement of knowledge. Since joining our faculty just a few short years ago, this scholar has built a remarkable and rapidly rising record of scholarly achievement. Her research explores how institutions, policies, and structural conditions shape social harm, from realities of the opioid overdose crisis to the complex dynamics of white-collar crime and reentry into society. Through sophisticated data analysis and innovative mixed method approaches, her work illuminates how justice systems respond to harm and how communities experience its consequences. Her scholarship has appeared in some of the most respected journals in criminology and criminal justice. Her research has reached audience beyond the academy, receiving national attention from outlets such as Forbes and National Public Radio, NPR. In recognition of her growing influence in the field, her recent work on reentry experiences of white-collar offenders was honored with the Outstanding Article Award from the American Society of Criminology's Division of White Collar and Corporate Crime. And just as impressive as her scholarship is her commitment to mentorship, guiding graduate theses, collaborating with students on research, and cultivating the curiosity and confidence in the next generation of scholars. Friends and colleagues, please join me in celebrating the brilliant builder of breakthroughs, the dynamic driver of discovery, the methodological master of mixed methods. That was a tough one. And the sensational steward of scholarship and socially scientific significance, steady in science, steadfast in significance, and already shaping the future of criminology and criminal justice. Please join me in congratulating the often imitated but never ever duplicated 2026 Florida Atlantic University Scholar of the Year at the rank of Assistant Professor, Dr. Diana Sun. Sarah, Dr. Sun, thank you for your extraordinary scholarship and the insight, integrity, and impact that you bring to the College of Social Work and Criminal Justice here at Florida Atlantic University. Back to you, Samir.
Thank you. I'm not sure how to follow that, but I'm going to try. So we're getting close to wrapping up, but we were not there yet. I wanted to have a little bit of fun. And so I made a Kahoot. I figured as Florida Atlantic University continues its ascendancy, it's important for us to really understand and know the history of the university. And so if you don't mind, I would love for you to take out your phone and load up the QR code that will hopefully pop up on your screen. There it is. And load up this website. Actually, it'll show up in your browser, whether it's Chrome or Safari. And then you'll have to type in that game pin. We're going to figure out how well you know Florida Atlantic University. Please pick a cool nickname. We will judge you. And also a fun avatar. Let me also mention that we have prizes, and they are not lame. Second and third place. I wonder who Toot Toot is. I should say that I pilot tested this in my research methods class, and we got Pete back there in the back left, and he's already knows all the answers. So you're not allowed to participate and win any of the prizes. I'll give you maybe 30 more seconds or less to load up that QR code, and then we'll get started. I promise this will be fun. Oh yeah, I'm feeling that. All right, let's go ahead and get started. Here we go. In what year did Florida Atlantic University officially open its doors? And don't worry, we're going to provide you with some options. There are your options. Pick a shape on your screen. We got it? We've got to move faster. 1964, file that away in your brain. Moving on. Well, actually, yeah, let's see the scoreboard. Pikachu, well done. Catherine's playing from wherever she is. What was the original purpose of FAU in our state university system? Here are some options. Whoa, sorry. Absolutely. Serving upper division and graduate students and augment our local community colleges. Photographer, well done. This was a while ago. 1964, 1964, you got this. You know history. Excellent. Well done, most of y'all. Cassandra, I love it. The first commencement ceremony held. Two-part question, double-barreled, which in methods we're not supposed to do. Oh, sorry for the typo. Only 30 degrees. Hard to believe, but true. June of 1965. Photographer making a run, Nugget making a run. Next question. So at some point, obviously, we did start admitting lower division students. What year was that? Wow, only 4 people got it right. 1984 is a big year.
Back on the board.
I want to see some new names. Let's go, everyone. How many degree programs do we currently offer? Yeah, a lot of you just picked the biggest number. Over 170. Okay, I'll work on that. My bad. Okay, so thinking about students across all of our campuses. And it's gone up and down over the years. Yeah. Okay. Oops, sorry. We'll fix that. Why did FAU choose the owl as its mascot? Y'all should know this. Excellent. 1971, a burrowing owl sanctuary. Have any of you ever seen a burrowing owl? Okay, it has. You've taken photos, I'm sure. Pikachu, crushing it. Curious if you know this, even though we are social scientists over here. You ever moseyed on over there to see? Shark Tank, a big one for research purposes and random feedings. Students might know this. On-campus residence halls here on this primary campus. Nine. No, four, actually. Next one. Win, making a run out of nowhere. I tried to get 2024, 25 numbers, but they're not public yet. So 2023, 24. $76 million. Estimates for 24, 25 are around 112 million. So moving on up. Black Panther. This might be too easy, but let's just see if anyone gets it wrong. Excellent. That is what I want to see. Well done, everyone. Making me proud. It's a random question, but I thought it was fun. Residence Hall, 2013, Fitness Center and views of the Atlantic Ocean. Just pick something. Parliament Hall. Speaking of owls, a group of owls are called Parliament of Owls, right? And so that's interesting. Love Chipotle. Making progress. This one's kind of simple, but I just wanted to see again, what's our baseline level of knowledge when it comes to our university? There's six. Six campuses. Scoreboard change, jam, out of nowhere again. Making a run. Y'all remember this, we were all alive. But can you get the year right? I remember exactly where I was when I was watching this game. (2023), well done. Just a few more. Some of our teams are very, very good. Not 19 teams. Well done, everyone. Just a few more. Thank you for your patience. Approximately what percentage of FAU student body attends classes here? On the main campus. About 70%. Well done, 7 of you. If you think about this one, you're going to get it. Dana, you're copying Ryan. Ocean. Yep, ocean engineering. And now it's a thing across many universities. We lead the way. Largest enrollment by college. It is the College of Business. Next one, we'll check the scoreboard next. Brand new university, 1964. What's our initial enrollment? Less than 1,000, 867. Some high scorers, seriously. This, I think, is just a fun historical fact. So back in 1942, the president wanted to station a number of troops here for World War II. Wow, handful of you knew that. That's very impressive. Army Air Corps. International students. We pride ourselves on being very diverse. And we do serve a significant percentage. That's a lot, right? 2,600. So with that said, international students, how many countries are represented? How many countries are there in the world? 110 to 180. That's pretty broad. I should have made that a little bit more narrow. Check the scoreboard. Shaney's rising. Okay. For sports fans, perhaps you know this one. Annual rivalry football game. Yeah, just copy off of Ryan. The Shula Bowl. Shula, who's Shula? In what year did the first FAU football player get drafted into the NFL? This one's a tough one, but I thought maybe some sports fans would know it. My precious, thank you. 2010, Rusty Smith by the Tennessee Titans in the 6th round. Do any of you know any other football players who've been drafted in the NFL? Yeah, Devil Singletary, who's back with the Giants. Very good. Anybody else? Giants have one of our safeties. Okay. Yes, Pete, go ahead. Trey Hendrickson with New Orleans. Very good. So we've had a few ever since 2010. Very proud of that. All right, let's see our podium. That was all the questions. In 3rd place, it is Cassandra. Well done. In 2nd place, we've got photographer. And in 1st place, whoever you are, it's Jam. Good job, Jam. Got it. Did you get hired based on your knowledge of FAU trivia? All right, that was fun. Turn that off. Okay. We've had a lot of fun today. We've learned a lot. Appreciate the passion with which you devote your energies and time to in terms of our professional work. Continue to try to make a difference, continue to co-labor together. We're going to link arms and continue to raise the profile of our schools and college. Now, as I end, I want to say that there's been a lot of momentum, and much of that momentum comes from students. And so we've got 5 students who've got research posters out there in the hallway, and their names are Dave Lucci, Sam Miniker, Vijayanar, Alexandru Pasarariu, and Shannon Ward. And so please, please, please take the time to say hello to them, to chat with them about their research. You know, we devote ourselves to our work, they're devoting themselves to their work, and it's very worthy of our time and our attention. Thank you so much for coming to our 3rd annual research symposium. We will see you next time. Thank you, Catherine, for all your help. Oh yeah, 1st and 2nd and 3rd place. Don't forget your prizes. Oh yeah. 1st has 1 up here. 2nd has 2 up here, and 3rd is 3 up here. I appreciate you, man. I think that's a beautiful word out. Yeah, I appreciate you, man. All the best.
So awesome.
Thank you. Thank you, Frank. Bye, Savora. Of course.